Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good day, everyone. Today, focus on a form of headache support that many people underestimate: vitamin D. Do not treat this as a magic pill. Treat it as a biological signal. Ask yourself, why would a vitamin known for bones have anything to do with pain in the head? How could sunlight, diet, and a blood level influence migraine attacks, neck tightness, muscle tenderness, and pain sensitivity? Start with this idea: a headache is not always only a head issue. Sometimes it is a nervous system issue. Sometimes it is an inflammation issue. Sometimes it is a muscle and bone issue. Sometimes it is a deficiency issue hiding in plain sight. So listen closely. If someone has frequent headaches, migraine attacks, pressure around the forehead, tightness around the temples, neck discomfort, fatigue, muscle aches, or pain that seems to travel between the head and the shoulders, do not jump straight to the strongest medication. First, step back and ask, what is the body missing? What is lowering the threshold for pain? What is making the nervous system easier to irritate? Vitamin D matters because it is not just a vitamin. It behaves like a hormone. It communicates with immune cells, muscle tissue, bone metabolism, and the nervous system. The blood test doctors use to assess vitamin D status is called 25-hydroxyvitamin D, and medical guidance recognizes that very low levels can reflect deficiency or inadequacy. The National Institutes of Health notes that vitamin D is produced through skin exposure to sunlight, obtained from some foods, and taken as a supplement when needed. It also emphasizes that blood levels and dosing should be interpreted with safety in mind. Now ask, why does this become important for headaches? Because the head is full of pain-sensitive structures: blood vessels, meninges, muscles, nerves, and inflammatory pathways. If vitamin D deficiency increases muscle pain, alters immune signaling, or sensitizes pain pathways, then the head can become one of the places where the body expresses that imbalance. So do this. Think of vitamin D not as an extra, but as part of the terrain. Pain does not appear only because of one trigger. Pain appears when the terrain is ready for it. Let us build the logic step by step. First, look at headache through the lens of pain sensitivity. Why does one person skip breakfast and feel fine, while another person skips breakfast and gets a migraine? Why can one person sleep poorly and recover, while another wakes up with pressure behind the eyes? Why does one person sit at a desk for 8 hours and feel only mild stiffness, while another develops a band-like headache? The answer is threshold. The nervous system has a threshold. When that threshold is high, ordinary stressors stay ordinary. When that threshold drops, light, noise, tension, poor sleep, dehydration, hormones, weather changes, and screen exposure become stronger triggers. Vitamin D may help because it appears to influence that threshold. Research on vitamin D and pain signaling discusses vitamin D receptors and their interaction with pathways involved in nociception, the body's process of detecting painful stimuli. In simpler words, vitamin D may affect how pain messages are generated and processed. So command your thinking to shift. Do not ask only, what can stop this headache today? Ask, what can make my brain and nerves less reactive over time? Second, examine inflammation. Why does inflammation matter in headaches? Because migraine, in particular, is not merely pain. It involves neurovascular activity, immune mediators, and inflammatory signaling around the trigeminal system. That system is one of the major pain networks of the head and face. Vitamin D has immunomodulatory effects. That means it helps regulate immune behavior rather than simply boosting it. This distinction matters. You do not want an overexcited immune system around pain pathways. You want regulation. You want balance. You want less biochemical noise. A comprehensive review on vitamin D in migraine described links among vitamin D status, immune function, inflammation, nociception, and pain, and reported that adding vitamin D to routine therapy may reduce migraine attack frequency in some patients. Now ask, how could that look in real life? It may not feel dramatic on day one. It may look like fewer headache days in a month. It may look like attacks that still happen, but with lower intensity. It may look like needing rescue medication less often. It may look like the neck and scalp feeling less tender. That is how biological repair often speaks, not with fireworks, but with patterns. Third, consider migraine evidence directly. Do not rely only on theory. Look at trials and summaries of trials. A meta-analysis of randomized controlled studies found that vitamin D supplementation compared with control treatment was associated with reductions in headache days, attack frequency, headache severity, and migraine disability scores. Pause there. Ask, why is that important? Because randomized controlled studies are designed to move beyond simple association. They do not prove that vitamin D is a universal answer for every headache, but they do show that supplementation can have measurable benefit in migraine populations. Another randomized, double-blind, placebo-controlled trial gave adult migraine patients vitamin D3 and found that headache days decreased more in the vitamin D group than in the placebo group by the end of the trial. So here is the practical command. If headaches are frequent, especially migraine-like headaches, check vitamin D status with a clinician. Do not guess forever. Do not keep treating every episode as isolated. Look for patterns. Measure what can be measured. Fourth, pay attention to tension-type headaches and muscle tenderness. Many people describe their headache as a tight band, a heavy helmet, pressure at the temples, or pain coming from the neck upward. Why would vitamin D matter there? Because vitamin D deficiency can affect muscles. It can be linked with muscle aches, weakness, cramps, fatigue, and bone pain. Cleveland Clinic's clinical overview lists muscle weakness, muscle aches or cramps, fatigue, bone pain, and mood changes among possible signs in adults, while also noting that some people have no obvious symptoms. Now connect that to the head. The scalp, jaw, neck, shoulders, and upper back are not separate from headache biology. Tension-type headache often involves pericranial muscle tenderness, tenderness in the muscles around the head. If the body is vitamin D deficient and muscles are more tender, painful, or fatigued, then head and neck discomfort can become more persistent. A case-controlled study examined vitamin D levels in patients with chronic tension-type headache, and clinical literature has discussed how vitamin D deficiency can mimic or contribute to chronic tension-type headache patterns, especially when muscle tenderness and generalized body pain coexist. So ask the person with headaches, do you also have neck soreness, shoulder tightness, general muscle pain, fatigue, bone tenderness, low mood, limited sun exposure, darker skin, indoor work, digestive issues, obesity, a restrictive diet? If yes, do not ignore vitamin D. Investigate it. Fifth, consider one of the most fascinating migraine-related molecules, CGRP, or calcitonin gene-related peptide. Why mention this? Because CGRP is deeply involved in migraine biology, and modern migraine medications even target CGRP pathways. A post-hoc analysis of a randomized double-blind placebo-controlled trial reported that vitamin D supplementation increased serum vitamin D levels and reduced CGRP levels in episodic migraine patients, although the relationship between vitamin D levels, CGRP, and headache outcomes was not perfectly linear. That last part is important. Say it clearly, biology is not always a straight line. More is not always better. A higher blood number does not automatically equal fewer headaches. The point is not to chase extreme levels. The point is to correct deficiency, restore balance, and reduce vulnerability. So use vitamin D with precision. Do not megadose casually. Do not copy someone else's dose from social media. Do not assume that if 1000 IU helps, 10,000 IU must help more. That is not medicine. That is gambling with physiology. Sixth, understand safety. Vitamin D is fat soluble, which means the body can store it. Excess intake can cause harm, especially through high calcium levels. The NIH fact sheet emphasizes recommended intakes, tolerable upper limits, and caution about excessive blood levels. So follow these commands. Get tested if headaches are frequent and deficiency is plausible. Discuss supplementation with a licensed clinician, especially if you are pregnant, have kidney disease, sarcoidosis, hyperparathyroidism, a history of kidney stones, high calcium, or take medications that affect vitamin D metabolism. Take vitamin D with a meal that contains some fat, because absorption is better when fat is present. Recheck levels after a reasonable interval if your clinician starts a correction plan. Track headache days, not just pain intensity. Use a calendar. Write down sleep, menstrual cycle if relevant, stress, hydration, sunlight exposure, and supplement adherence. Why track? Because memory lies when pain is emotional. A diary tells the truth. If headaches drop from 12 days a month to 7, that matters. If severity drops from 8 out of 10 to 5, that matters. If rescue medication use decreases, that matters. 7th, place vitamin D where it belongs, inside a full headache strategy. Do not replace emergency care. Do not ignore warning signs. If a headache is sudden and explosive, if it is the worst headache of life, if it comes with weakness, confusion, fever, stiff neck, vision loss, fainting, seizure, head injury, cancer history, pregnancy complications, or a major change in pattern after age 50, seek urgent medical evaluation. For ordinary recurring headaches, build the foundation. Sleep consistently. Hydrate. Eat regular meals. Manage caffeine wisely. Correct magnesium or B12 issues if present. Address jaw clenching, posture, screen strain, and stress load. Then add vitamin D when deficiency or low intake is part of the picture. Ask again, how does vitamin D help? It may help by supporting immune balance, reducing inflammatory tone, improving muscle function, supporting bone and nerve health, and raising the pain threshold. It may be especially useful when the headache pattern lives together with fatigue, muscle tenderness, low sunlight exposure, and low blood levels. Ask, why does it not help everyone? Because headaches have many causes. A person with dehydration headaches needs fluids. A person with medication overuse headache needs a careful medication plan. A person with sleep apnea needs airway treatment. A person with uncontrolled blood pressure needs medical management. Vitamin D is not the whole map. It is one route on the map. But when it is the missing piece, it can be powerful. Let us close with a clear message. Do not look at headaches only as pain to silence. Look at them as signals to decode. Ask better questions. Why is the nervous system irritated? How low is the pain threshold? What does the body need to stabilize? Vitamin D can be beneficial because it touches several systems connected to headache. Inflammation, pain signaling, muscle health, bone metabolism, and possibly migraine-specific pathways such as CGRP. The literature does not say that vitamin D cures every headache. It says something more clinically useful. In selected people, especially those with low levels or migraine patterns, supplementation may reduce headache burden, so act wisely. Test when appropriate. Supplement safely. Track results. Pair vitamin D with sleep, hydration, nutrition, movement, and medical guidance. Use it not as a shortcut, but as a targeted correction. And remember this, sometimes the body does not need something exotic. Sometimes it needs a basic signal restored, light converted into chemistry, chemistry converted into balance, and balance converted into fewer painful days. Thank you for being here with me today. Take care of yourself, take care of your people, and I'll see you in the next topic, like family continuing a meaningful conversation.